Have you ever noticed your hands or legs shaking as you move them? Have you ever experienced slowness when moving? Or even struggling to move because of muscle stiffness? If you are experiencing these symptoms, there is a great chance that you might have Parkinson's disease. But don't worry, in this series video, we will understand this disease, uncover viable treatments and preventions to minimize its harmful effects. In this series, we invited an expert in order for us to better understand this very complex neurological disease. Dr. Elton Ong is a neurologist from Metro Vigan Cooperative Hospital in Vigan, Ilocos Sur. But first, we must answer, what is Parkinson's disease?
In Parkinson's disease, there's a degeneration of a part of the basal ganglia, so much so that the control of a particular action becomes lost.
Deep inside the brain, we can find the basal ganglia. The basal ganglia is a region of the brain that is responsible for motor control. Like any part of the brain, the basal ganglia is made up of neurons which receive and relay signals. In this case, these neurons carry signals which tell our muscles to move or relax. In an individual with Parkinson's disease, however, the neurons in their basal ganglia are damaged or even die off. As a result, affected individuals experience motor symptoms such as rigidity and tremors. Parkinson's disease is one of the most common neurodegenerative diseases and affects individuals globally. Statistics show that around 1 to 2% of adults aged 60 and above are diagnosed with Parkinson's disease, and that the disease occurs more frequently in males compared to females. Even if you're not in your senior years, this doesn't necessarily mean that you cannot develop the disease. In his 18 years of practice, Dr. Ong has encountered several young patients who were diagnosed with Parkinson's disease.
I think I have a patient who's in his 20s, and then there's another patient in his 30s and 40s. Although, as you all know, diba, Parkinson's is actually a disease of adults and those elderly. Usually it's 50, 60, 70 and above, diba? But we're also seeing rare cases na appearing in patients who are already only in their 20s and in their 30s.
To learn more about the symptoms and the science behind Parkinson's disease, tune into the next episode.